So, hi everyone, this is Dr. Uneza and I'm a physiotherapist, educator, and creator. And today I'm going to talk to you about a very common scenario which occurs almost all the time in ICUs, which is a collapsed lung. Okay, I have added a lot of content on it on my Instagram. I always talk about it. I share the x-rays of pre and post physiotherapy when there is a collapsed lung, as well as when in my workshops I teach about it, how the treatment protocols work, how you can combine different techniques and make a use out of it. But the thing is how you would know and how to even assess it and how to know about it, if you can do it or if you are supposed to do anything, or if a pulmonologist or interventionist has to take a call, that you also need to know when to do and when not to do the physiotherapy when it comes to a collapsed lung patient. Okay, what happens is mostly during the morning rounds of my ICU, I see the x-rays first, then I go to the patients one by one, and then mostly before chest physio, we do auscultation. So we see the vitals, we see the charts, and ABGs, all these things, oxygen requirement of the patient, stuff like that. At times what happens is when we reach to the patient, they are in a little dyspneic state. Okay, we can see that the oxygen saturation is dropping or the oxygen requirement has increased from the previous day. So this indicates like there is something which is wrong with the patient. So mostly when I see the x-ray, we come across that there is a collapse of the lung. That is, one side of the lung becomes completely white out, and when you compare it to the previous day, it would not be like that, or there will be a progressive collapse, that it was there in the lower lobe first and then the whole lung has been collapsed. So how you actually approach those patients, that is the key thing when it comes to practice in an ICU as a physiotherapist. Because if you're working in the ICU, you need to be a quick thinker. Okay, you need to have certain things on your tips to assess and to know what is wrong with the patient. So if you're seeing these signals that tachypnea is there, SOB is there, and the patient saturation is falling, the PO2 is worsened, the X-ray is like that, that means the patient requires certain techniques to be implemented to open the lung. Okay, but if the saturation drop is too sudden, and if the increased oxygen that you are giving is not reversing that saturation, okay, and is not making the patient well, and it is affecting the patient's dynamics like anything, like sudden crash it is happening, then you're supposed to wait and involve the interventionist for the intervention, because that time maybe an emergency bronchoscopy is also required. Okay, so you will first go about those patients and do the auscultation. In auscultation, since there is a collapse, there won't be any air entry, so you will not hear any air sound. It's important to do the pre-auscultation so that you can make out post your physiotherapy treatment if there is a difference in the air entry or not. Okay, always do that. So this is a common scenario which keeps on happening in our ICU, because there are old age patients, there are COPD patients, bronchiectasis patients, patients who have retained secretions, pneumonia, and all those things. So in even mechanical ventilator patients, they all have a common thing, that there can be a mucus plug which has stuck in the main bronchus, and that has led to the collapsed lung. So I combine few techniques together, including the postural drainage, manual hyperinflation, along with vibrations, percussions, and suctioning, as well as if the patient is conscious and is able to make some effort, then cuffing. If the cuffing is poor, then cuff stimulations, and then you put the patient into recovery, and you definitely have to make sure that the oxygenation is there, and you give increased pre-oxygenation to the patient while you're performing any of this. Then after completing all these treatment, I go for a post physio auscultation to check for any air entry. Most of the cases air entry comes. Certain cases, if there is a not a complete opening of the lung, then you can actually assess कि, okay, the lower lobe, there is still absent lung sound. That means the lower lobe is still collapsed. So that you have to assess and decide then when next you have to do the same procedure again. That way we have opened a lot of lungs in ICU patients, and non-invasively, just with the combination of the right techniques. You need to know how to implement it. Your skills needs to be there, your confidence needs to be there, that okay, I can and I am able to do this. All right, so then we get an x-ray done mostly, and we compare the pre and post. I've uploaded a million x-rays on my Instagram like that, where I have compared the pre and post physio, which is mostly like an hour apart. Okay, so with that you can actually see how effective and how you can save the patient from undergoing any invasive procedures, if you know as a physiotherapist how to assess the patient, how to act timely, how to know and what to and when to do to patients, you can actually make a difference in the ICU, and you will be appreciated in the multidisciplinary team. You will be appreciated as a physiotherapist. You will actually represent that, okay, physiotherapists are not just there to move the limbs, they are there to make a difference, and that you are doing on your part. So you need to upgrade yourself a lot. You need to learn the techniques. You need to know about the ventilator and all these things. And for that matter, actually, I have learned a lot during my practice as well. I have done my MPT cardiopulmonary, no doubt, but what you learn and study in your masters doesn't mean that you're actually going to use all of it, and doesn't mean that actually all those things exist. Practical life is very different. You need to combine both. You need to upgrade, and you need to be aware of the recent guidelines as well when you come and when you are supposed to practice. And ICU is a very critical area. You need to have that critical thinking, emotional, detachment from the patients, as well as your knowledge of the techniques, assessment, and your rehabilitation. Okay, so that's how it works in the ICU. Even if the patient collapses in front of you, you need to know the basic life support. You need to know how to give the CPR. You need to know how to palpate the pulses and everything, and how to actually make a call. All right, CPR and all, it's not a big deal. It's supposed to be known by even a normal individual, even school going kids. Do not be afraid to learn CPR. Do not be afraid to implement it if you are getting that the patient is getting sick. It's a very basic thing. I always say, and I always promote all the physiotherapists to go and learn basic life support, to learn CPR, because you are going for home visits as well to the patients. There are fragile patients, there are old age patients, patients with comorbidities, multiple heart conditions, or anything like that. Anything can happen, and you will be the medical practitioner there. You will be the physiotherapist. You will be the doctor standing there. And if you won't be able to do anything, then it's a big shame and big loss for you as a professional, I would say. So those who all are practicing seeing patients, even in the OPDs, even in the home, clinic, hospital, IPD, ICU, must learn CPR, must learn the basic things and techniques that you should know in the ICU, like ventilators and all, is very important. Okay, and that's why I, in my workshop, actually teach you all about it, so you can practice in the ICU very confidently, how you can use all the equipments and everything to improve your skill. Okay, so my workshop and all, I keep on updating on my Rehabilified channel on Instagram. So you can go and subscribe to that, as well as you can follow me on Instagram as Cardiopulmonary Rehab, which is already there. So yes, that's about today. I will be discussing more and more cases with you all. What more things you want to know, how, what videos you want me to make, do let me know in the comment section. And don't forget to like, share, and subscribe to my channel. And don't forget to press the bell icon so you never miss a video from Cardiopulmonary Rehab.